Did you know that the more distance you maintain between your car and the vehicle in front of you, the more time and space you will have to respond appropriately if its driver slams on the brakes? Maintaining the correct following distance provides you with enough time and space to react and avoid a collision in the event the vehicle directly in front of you comes to a sudden stop. This message is brought to you by the Bermuda Road Safety Council.
Good evening, Bermuda. Our goal as a country is to move beyond the pandemic. Through sacrifice, cooperation, and hard work, we have steadily made progress towards that goal over the last few months. We have seen a reduction in local transmission, a reduction in hospitalization, where we currently have no one in the hospital with the coronavirus, and continued progress with our vaccination program. These important milestones have allowed us to remove the majority of restrictions, allow more businesses to open, more Bermudians to get back to work, and more activities to be enjoyed by residents and visitors alike. However, we must remain conscious that the pandemic is not yet over, and that the coronavirus can quickly impact our lives again if we let our guard down. The only way for the coronavirus to enter our community is through our borders, and this is why strong protections are necessary. The government is committed to protecting Bermuda from dangerous variants that could see our progress undone, as it has been in other countries around the world, such as Barbados, where nighttime curfew has been reinstated in just after 2 weeks when it was lifted, with social gatherings again banned and spectators now banned from sporting events. The British Virgin Islands has also reimposed a nighttime curfew, closed bars, gyms, hairdressers for an initial 14-day period, in response to an outbreak that has seen active cases increase from 0 to 1,147 within a week, and seen their country suffer an additional death. There are many who have questioned the government or asked us to change our strong approach to testing, border protection, and acceleration of our vaccination program over the last few months. I would ask those persons to look at the examples I have given, where countries that have not acted as decisively as Bermuda are now working to contain outbreaks and have had to reimpose restrictions in an effort to reduce coronavirus spread. Our testing regime has been strong throughout the pandemic and has helped us to catch positive cases, to understand the variants that are affecting us, and to make decisions based on science and data. Our border protections help us to keep dangerous variants out and help us to keep our schools and camps open, restaurants and other businesses thriving, and to protect the freedoms that we enjoy here on island, especially during the summer. Though some may not agree, I do not believe that there is anyone in our community who wants to see students sent home from camps or businesses close again. This evening, we will hear from the Minister of Health on our continued progress with our vaccination program and the latest coronavirus testing results and other matters from her ministry. We are also joined by the Minister of National Security, the Honorable Renee Ming, who will provide the country with an update on the number of persons in mandatory hotel quarantine, enforcement, and other matters from her ministry. The government's Chief Medical Officer, Dr. Ayo Oyenloye, is present to address questions on antibodies and immunization, as well as to answer any medical questions from the media. And tonight we're also joined by the Commissioner of Police, Mr. Stephen Corbishley. First, we'll hear from the Minister of Health. Minister?
Thank you, Premier, and good evening, everyone. The Ministry of Health received 7,733 test results since the last update, and 4 were positive for COVID-19. This gives us a test positivity rate of 0.05%. These results are from the testing that was completed on the following dates. Thursday, the 8th of July, 2 were positive out of 2,050, which represents a positivity rate of 0.0%. On Friday, July 9th, 1 was positive out of 1,923 tests conducted and results received with a positivity rate of 0.0%. And on Saturday, July 10th, 0 were positive out of 1,950 results with a positivity rate of 0.0%. Sunday, the 11th of July, 1 was positive out of 1,810 with a 0.0% positivity rate. All 4 of the new cases are classified as imported with their details as follows. 2 residents who arrived on British Airways flight BA159 from London on the 4th of July 2021 and tested positive on their day 4 test. 1 resident who arrived on American Airlines AA2044 from Charlotte on the 9th of July 2021 and tested positive on their arrival test. And 1 resident who arrived on Delta Airlines DL617 from New York on the 7th of July and tested positive on their day 4 test. Additionally, since the last update, there were 4 recoveries and no deaths. There are currently 11 active cases, of which all 11 are under public health monitoring and none are in hospital. Since March 2020, Bermuda has recorded 2,525 total confirmed COVID-19 cases, and out of those, 2,481 persons have recovered, and sadly, there have been 33 COVID-related deaths. The source of all cases is as follows. 329 are imported, 2,193 are classified as local transmission, of which 1,698 are local transmission with a known contact or source, 495 are local transmission with an unknown contact or source, and 3 are currently under investigation. As investigations proceed, transmission categories may change, and the 7-day average of our real-time reproduction number is less than 1. Bermuda's current WHO country status remains at sporadic cases. The decline of new coronavirus cases in Bermuda is extremely encouraging, but we must not let our guard down. I want to thank the community for continuing to do their part in following all of the public health guidelines, caring about the health of all of us, and helping to keep our community safe. Yesterday, the United States Centers for Disease Control and Prevention, or the CDC, adjusted the travel health notice for Bermuda, de-escalating Bermuda's status from level 2, which was moderate, to level 1 for COVID-19, which is a low level of COVID-19 in Bermuda. And this is great news for Bermuda and indeed a step in the right direction as we work hard to get more visitors to our shores. I'd now like to switch gears for a moment and provide you with an update on the vaccine program. We've completed the 26th full week of vaccinations. Since the 11th of January, Bermuda has administered a total of 82,050 vaccinations. And of those 82,050 vaccinations given as of July 10th, 52% are women and 48% are men. 82.1% of all residents over the age of 65 have had at least 1 vaccination, and 80.8% are fully immunized. And to date, 64.8% of our population has been vaccinated, having had 1 dose, and 63.3% of the population has been fully immunized, having had 2 doses. The Pfizer-BioNTech vaccine is available at KEMH Vaccination Center, and walk-ins are available between the hours of 4 and 7 p.m. Monday to Friday, and 8 a.m. and noon on Saturday, and the vaccination center is closed on Sundays. I recognize that there is a lot of reluctance around getting vaccinated coming from a lot of misinformation. However, the benefits of vaccination outweigh the risk at this time. I encourage anyone who is trying to make up their mind about getting vaccinated to seek information that is supported by science and rely on the guidance from reliable sources. Now is definitely the time to get vaccinated while we have enough supply doses here in Bermuda. The sooner you get vaccinated, the sooner you are protected, and the sooner our community is protected, and the sooner that we can get back to normal. The longer you wait to be vaccinated, the higher your risk of catching COVID-19, and the longer we will have restrictions. The government is extending vaccine-based resident safe keys for 1 month. So those vaccine-based safe keys that are due to expire on the 15th of July, those that have them can go to the following website, gov.bm/safekey, to have their safe key extended until the 15th of August. For those needing assistance with their travel authorization, there is now a toll-free number available for travelers calling the COVID-19 hotline from the United States and Canada, and that number is 1-833-570-2594. and that actually information can be found on the government website. Also, as additional staff are hired and trained, the call center will be extending its hours of operation beyond the current 8 a.m. until 8 p.m. In closing, there's been much discussion in the news media and on social media platforms about natural immunity. Let me be clear. Having a prior infection of COVID-19 is not the equivalent of a vaccination. A prior infection is not and has never been accepted as an approved version of vaccination. The CMO is present, as the Premier indicated, and he will be speaking in more detail regarding the differences between immunity from infection and immunity generated following immunization. However, I can say that the strength of the protection offered by the vaccine is designed to give the body the best chance of fighting off the virus with minimal side effects. The strength of protection offered by infection really depends on the amount of the virus that enters the body and how ill the patient becomes. Patients with milder infections generally have lower levels of antibodies in their system compared with patients who have severe infections and were hospitalized. The best protection against COVID-19 is provided through the vaccines. Bermuda's list of approved vaccines, which will allow a traveler to be exempt from the 14-day quarantine, are as follows. The Pfizer-BioNTech, AstraZeneca, the Serum Institute of India's Covishield, which is AstraZeneca, Johnson & Johnson, and Moderna. Please remember, each of us must do our part to help to stop the spread of the coronavirus. It is essential that we follow all public health guidelines, as I stated before. We wear a mask, we practice good hand hygiene, we maintain physical distancing, and we download the We Health Bermuda app. Do your research. Talk with a reliable source and make an informed decision about getting the COVID-19 vaccine. There's a wealth of information about the vaccines online at gov.bm. Thank you.
Thank you, Minister of Health, and thank you for all the work that you and your team at the ministry continue to do as we work to move beyond the pandemic. To be close to 65% of our population fully immunized against the coronavirus, the feat that we should all take comfort in, as it means that a significant majority of our population are protected from severe illness and that we will continue to improve community protection. As the government submitted to the Supreme Court in the legal challenge last week, our statistics show that since June 20th, unvaccinated travelers are 19.6 times more likely to test positive on or after arrival in Bermuda. And since May 3rd, no vaccinated travelers who have tested positive have transmitted the virus to others. The only local transmission from imported cases has been from unvaccinated travelers. This data speaks to the effectiveness of the vaccine as well as the reasonings for the protections that we have in place at our borders with mandatory hotel quarantine, which has been acted and is law. The government must be driven by science, not emotion, not political point scoring, not WhatsApp forwards, but science. It is what has made us successful to date, and we must continue to trust the science. Every citizen in this country has a legitimate expectation that the laws enacted by their democratically elected representatives will be followed, and when not followed, enforced. This weekend, we saw a planned and deliberate breach of the law, which to date has gone unenforced. Let me be clear. The government's policy on the requirements for supervised hotel quarantine of unvaccinated travelers is unchanged, and the expectation is that the law will be enforced. The attempts of some in this community to make false comparisons of the selfish and reckless actions we all witness, with some recognized historical causes for social justice and hard-won freedoms, are quite frankly offensive. I have made the government's position on this matter clear to the governor, and I wish to leave no doubt in the mind of others who may take it upon themselves to test our resolve. The expectation of the government is there will be compliance with the law, and where the law is breached, there will be enforcement. I will now invite the Minister of National Security, the Honorable Renee Ming, to comment on the quarantine hotel operation and any other matters from her ministry that she may wish to share. Minister Ming?
Good evening, Bermuda. I will offer a brief update regarding our management of the quarantine facility since we introduced our most recent COVID-19 quarantine guidelines. As a reminder, all non-vaccinated travelers arriving in Bermuda are required to do a mandatory 14-day quarantine at a government-authorized hotel. The cost of the stay is at the traveler's expense. There are currently 7 approved quarantine locations. I wish to note that as of tomorrow, Fairmont Southampton will be online for bookings. Anyone looking for information on how to arrange a quarantine hotel should visit the government website. I want to stress that border protection is important as we aim to relax restrictions. The implementation of the quarantine facilities continues to effectively protect us from the dangerous new variants that exist. As of to date, I can report that there are 93 people currently in quarantine facilities in 77 rooms. 61 rooms have been paid for by the government, and 28 people have paid for themselves. This past weekend, there were 10 checkouts. Since the start of the mandatory quarantine program, a total of 149 travelers have been quarantined. Lastly, I think it's important to reiterate the fact that the Ministry of National Security continues its management of the various quarantine facilities. We've taken steps to ensure that all guests are provided with the support and necessities they require during their 14-day stay. Once a guest arrives at the hotel or guest house, they are greeted by a government representative, checked in, and shown to their rooms. Food and amenities are available for guests. We appreciate that there are those in the facilities who need specialized items, and again, we have made accommodations. Persons who have family or friends in quarantine can drop essential care packages at the front desk of the hotel or guest property. Additionally, a daily schedule, including the daily staff roster and the activities, are made available to all guests during their 14-day stay. While guests must remain in their rooms, they are also able to engage in prearranged activities such as walks, high-intensity training, yoga, and meditation classes, and other wellness activities. Finally, Bermuda, we appreciate that these continue to be testing times. I wish to thank the public for their continued compliance of the health guidelines. The reality is that these are unprecedented times, and we all need to work together to get through this pandemic. We may not always agree, but we must always be respectful. I encourage all residents and visiting travelers to stay informed about all of our quarantine guidelines by visiting www.gov.bm/coronavirus. Thank you.
Thank you, Minister, for you and for your team, for your management of this operation, and for your vital work throughout the pandemic. While we know that quarantine of any kind is not easy, I'm glad that the government can support a number of Bermudians who are required to do so by covering the cost of their stay. We're also grateful to the dozens of persons who are in quarantine and simply following the guidance, cooperating, and remaining there until it is time for them to leave after 14 days. Thank you to also all of the hotels involved, as well as their staff and security staff, for assisting the Ministry of National Security. Now I will ask the CMO to provide clarity on why antibodies are not accepted as a form of immunization in Bermuda for the purposes of protection at our border. Chief Medical Officer, please.
Good evening, Bermuda. Tonight I will be talking about why, the differences between immunity generated from COVID-19 vaccines and how they differ from that you get from an infection. To start with, I'd like to describe very briefly how the body fights infection, because that's important to set the stage for why we have taken the stance that we have. So, to understand the difference between immunity after infection and immunity after vaccination, we need to understand the way the body reacts to a foreign body. In this case, the SARS-CoV-2 virus. That's the virus that causes COVID-19. So when the virus enters the body, the cells known as the antigen presenting cells, APC for short, recognize it, they engulf it, break it down into its components. And these components are then expressed on the surface of the APC, where another part of the immune system, these cells are called T lymphocytes. They are activated by those cells presented on the APC, and they in turn activate all the soldiers in the body. So one of the soldiers is what is called the killer cells, and these are specific cells that target viruses or infected cells and kill them. And the other group of cells are called the B lymphocytes. These lymphocytes change into two types as well. One is a plasma cell. Those generate large amounts of antibodies that fight any virus that enters the body. And the other group of cells is the memory cells, and these lay dormant in the body but can be reactivated by future infection. Okay, so the difference between immunity from an infection and immunity generated following vaccination is that instead of the whole virus being introduced to the body as you'll find in an infection, only one part of the virus is introduced. This means that with vaccination, there's a consistent reaction to one component of the virus. In this case, it's the spike proteins from the mRNA vaccines that we use on island, and is given in. The advantage of vaccination is that the dose that is given to the individual is predictable, is measured and predictable, and there's immunity to a specific part of the virus, that's the spike protein, and you can easily measure it. With infection, the immunity to the virus can be to different parts of that virus, and the protection offered isn't consistent. The strength of the protection offered by vaccine is that it's designed to give the body the best possible chance of fighting off the virus with minimal side effects. The quality of the protection offered by infection depends on the amount of virus that enters the body to start with and how ill the patient becomes. So patients with milder infections generally tend to have lower level of antibodies in their system, whereas patients who have had severe infections generally resulting in hospitalizations will have a lot higher levels of antibodies in their systems. Vaccines are designed to provide protection over a wide range of mutations of the virus, as its target points on the spike protein are designed on the vaccine are quite broad. This is not always the case with natural infection. And the practical implication of this is that the vaccines provide a wider protection against variants of this virus and keeps outbreaks from starting. The length of immunity after infection varies very widely. As stated earlier, it depends on the strength of the infection and the parts of the virus that immunity is developed against. There have been studies to show that immunity following infection starts to wane from between 3 and 8 months. The immunity developed as a result of vaccines are much more consistent. Trial participants have evidence of ongoing immunity against the virus over a year after the trials have started. The total length of immunity following vaccination is still up for debate, as it is still being investigated. As I said earlier on, a year after the trial started, patients are still demonstrating strong immunity to this virus. The other point to make is that measuring protection offered after vaccination and natural infections can be quite complex. The commonly used test is the antibody test. We test only one of the several components of immunity. As I mentioned earlier on in my statement, there are different components to this. It requires very careful interpretation as the level of antibodies fluctuates significantly and must be considered within the epidemiology context that we are looking at. So it's not just simple yes or no. So therefore, the national testing policy published by the COVID-19 Strategic Testing Committee reviews the evidence and state that antibody testing should only be used as part of patient or outbreak investigations. Finally, Bermuda, I'd like to remind you that several countries around the world have abandoned plans to achieve community immunity from infections. The costs in human lives, immediate and long-term ill health is simply too great. Many countries in Europe started out with this policy but have had to pivot because of the misery caused by deaths, poor outcomes and overwhelmed health systems. Recent data also shows that provide further documentation that even those who have recovered from COVID-19 infection still stand to benefit from getting vaccinated. The evidence continues to suggest that acquired immunity from vaccines still offers substantial protections against new variants now circulating across the globe. So, in closing, the quality of immunity that you get from vaccination is by far superior to what you get from a natural infection. Thank you.
Thank you, CMO, for explaining the science that the government must follow and are following as we take actions to keep our country safe. As we continue to move beyond the pandemic, we have been able to enjoy the return of sport and a return of our important summer cricket events. This weekend, Bermuda can again enjoy the Eastern Counties Cup Series at the Seabreeze Oval. The government of Bermuda was proud to support the Eastern Counties Cricket Association with a $20,000 grant to ensure that the event is a success. The Eastern Counties has been permitted to allow 1,250 fans into the ground, and all in attendance must be in possession of SafeKey. Persons can obtain SafeKey through receipt of a negative coronavirus test, which will be valid for 72 hours from the time of testing. Anyone needing a test in order to obtain a SafeKey for this Saturday's Eastern Counties match can go to the Clock Tower Mall on Dockyard Wednesday and Friday between 10 and 3, or Penno's Wharf on Thursday between 10 and 3 p.m., or they can book an appointment at Bull's Head in town on Wednesday, Thursday, or Friday. And you can book an appointment at coronavirus.gov.bm. Persons with a vaccine-based SafeKey will be able to renew it this Thursday, the 15th of July, when it is currently set to expire for another month until the 15th of August. They can do this and learn more about SafeKey by going to gov.bm/SafeKey and clicking the link at the top of the page to renew. All persons attending must have a valid ID along with their SafeKey, as SafeKeys are checked with IDs to ensure that it is for the person for whom it is issued. As we enjoy our progress locally, we can also be proud of the resurgence of our tourism industry. As tourism was able to restart in 2020, we learned that the reason persons chose Bermuda was because they felt safe thanks to our successful management of the coronavirus through rigorous testing and appropriate regulations that balance public health and economic activity. The confidence amongst our visitors in gateway countries has been carried into 2021, with the CDC recently announcing the lowering of Bermuda's COVID status from level 2, moderate levels of the virus, to level 1, low levels of the coronavirus. And this following Bermuda's addition to the UK's green list at the end of June. Excellent progress. These achievements will not only help already improving tourism statistics, which shows hotel occupancy increasing in some cases, hotels are reporting approaching 2019 levels. Bookings are strong. With the success of the home porting program, which has begun with the Viking Orion cruise ships, we are now seeing increased interest from other cruise lines to come to our shores. The Minister of Transport continues to work with these cruise lines to set out the necessary requirements, and I'm confident that we will see more cruise ships in Bermuda this season. But this is only possible due to our border policies, which are designed to keep dangerous variants out of Bermuda. The government will also continue to support Bermudians in need, as we recognize that the economic impact of the pandemic will not dissipate as quickly as we would like. Yesterday, the Minister of Labor, the Honorable Jason Hayward, announced the extension of the supplemental unemployment benefit until March 2022. Through this program, the government has provided over $1 million of support to 127 families and will continue to assist individuals and families in their times of need. Our determination to support Bermuda and Bermudians also involves our plans for economic recovery for our country. Initiatives such as the Economic Investment Certificates, which were part of the government's economic recovery plan, are a critical component to that recovery and have already attracted more than $30 million of investment to our local economy since it commenced on the 1st of March. This shows the progress already being made as the government is able to refocus its energy and resources from tackling the coronavirus to stimulating our economy, providing opportunities for growth, and helping to get Bermudians back to work as we successfully execute our strategy to move beyond the pandemic. Before I close, I would like to share a story from this weekend. My wife and I were invited to an event on Saturday night, and I had a conversation with a staff member working at the event. This young lady said, "Premier, I'm not vaccinated, and I do not agree with everything that you've done. But thank you for working to keep us safe." She then told me that this is the first time that she's worked an event since the beginning of the pandemic, and she's thankful for the leadership of the government that enabled her to be able to return to do something that she loves. As a country, progress means nothing without unity. As can be seen from the interaction with the young lady, unity does not mean that we agree on every point or every action, but that even when we disagree, we find the common ground and understanding needed to move forward and work to achieve our goals. That is what the government of Bermuda is committed to, that is what this cabinet is committed to, and that is what we will continue to do in order to successfully execute our strategy to move beyond the pandemic. With that, I'm happy to take questions from members of the media.
Premier, we'll start with Bermuda Broadcasting.
Good evening. In the case of the Watson Cannoneer family breaching the quarantine order and refusing to quarantine at a hotel, government has stated that it expects the matter to go before the courts. For this to happen, we understand that the Department of Health must first instruct the police to investigate and create a file, which they must subsequently forward to the DPP. Has the Department of Health given that instruction to the police, and if yes, when?
That process is ongoing. You will no doubt hear more about this tomorrow. However, and history will answer your question tomorrow, but the information has been provided to the police, the statements have been provided, and the DPP office is seized accordingly.
Thank you. For almost 2 weeks, Bermuda Broadcasting's Gary Foster Skelton has repeatedly sought an answer as to how many times the Department of Health has instructed police to investigate quarantine breaches, and with no answer given, and the fact that Sunday's police action appeared to be a first, the station will presume the answer is few to none until told otherwise. This begs the question, government has repeatedly said the third wave of COVID infections started with a quarantine breach. If quarantine breaches are so demonstrably dangerous, why did it take almost 5 months before the Department of Health instructed the police to take such action as was seen on Sunday?
You have to appreciate that the officers within the Department of Health, the caseworkers or nurses, and first and foremost, obviously, their job entails case management, contact tracing. There were several months in which they were having to do contact tracing for just under 2,000 individuals. It's a very labor-intensive process. They have almost completed the process with respect to putting together their statements and so forth, and we're working with the police so that files can be completed. There have been, like I said, a number of other high-pressing matters that they've had to deal with in the midst of the pandemic. However, now there's a little bit of a pause. There's no statute of limitation period that we're concerned about. They're putting together the files and working hand in hand with the police.
Okay. Thank you. Why are some people who are going to the quarantine hotel allowed to greet their friends and family walking to the quarantine bus? I saw a video of a well-known local businessman and his wife hugging their daughter and granddaughter who was on their way to the COVID bus. I've seen other photos of people taking pictures in front of the COVID bus with their family who were not going to be on it. What is the point of quarantining people in a hotel for 2 weeks if they're going to be hugging and greeting family members and friends on the way to getting on the COVID bus? Doesn't it defeat the purpose of the quarantine?
I can't comment on that. I'm not familiar with that information, and having the information that you just provided about people hugging and greeting persons en route to the bus. I can't comment. I'm not familiar with that.
Thank you. Fully vaccinated people are still having to go through 5 tests on returning to Bermuda pre-arrival at the airport days 4, 8, and 14. By now, the government must have collected more than enough data to have a statistically accurate sample size on which to make a decision as to whether this testing is still necessary for those fully vaccinated. How many of those who are fully vaccinated are testing positive on days 4, 8, and 14?
I don't have that in front of me, that information. That is quite specific, and I did get the email from you at around 2:30, and I was in cabinet. However, that is the subject matter of a parliamentary question on Friday, so I will be providing all those details during that parliamentary question, outlining the particulars. It's exactly the same question, in fact.
Okay, thank you.
You may not, well, now have the Royal Gazette.
Good afternoon, Owen Johnson Barnes with the Royal Gazette. Now, before I start asking my questions, I do have a statement I've been asked to make. On behalf of the Royal Gazette, I wish to state that we strongly object to the 4-question limitation imposed by yourselves. When the press conferences are held every 2 weeks and COVID data is only released twice a week, the public is deprived of vital information. When each media organization is restricted to 4 questions, we also dispute the claim that when we ask these questions at press conferences, they are answered. Sometimes when we ask them outside of the press conferences, it can take days or weeks, and often by the time we receive the information, it is out of date and redundant. Thank you for listening. Now I'm going to start with my 4 questions. Started off with a story in today's Royal Gazette quotes Dr. Karika Weldon stating that Bermuda will need 87.5% immunization to achieve herd immunity if the Delta variant takes hold. Given that the Delta variant is now on the island, will the government be needing to review the herd immunity rate, which has previously been quoted at 70%? Should it be raised, and if not, why not?
I think I responded to that question actually last evening, that we are constantly reviewing the data and our percentages and looking at best practice internationally, and when decisions are made, they will be communicated accordingly.
Can you say how many cases of the Delta variant have now been recorded in Bermuda, and how many of those individuals were immunized?
I don't have all of those particulars in front of me. I'm afraid I can't provide of the 13 latest cases that were imported since our last press conference. 92% of those persons represented the Delta variant and 8% were the Alpha variant.
Now, obviously we had a family arrive in the island on Sunday who have ignored the requirement for mandatory supervised quarantine, who refused. We understand that more people are going to be coming to the island who intend to take the same approach. Does this not make a mockery of the supervised quarantine policy that they were allowed to just walk right past the bus and get into their vehicle?
As the Premier indicated, there are actions to breaches, and enforcement will be pursued to the fullest extent of the law with respect to any breaches that occur in Bermuda concerning our COVID orders and our COVID regulations.
Now, Mr. Premier, 2 weeks ago you told protesters that the government would scrap mandatory supervised quarantines when Bermuda reached 70% herd immunity. This does not seem to be part of the stated government policy. Is it in fact part of the policy? And if it is achieved before September 30th, will it actually come into effect and everything be lifted?
I'll ask you to repeat your question again, but before you do that, you'd asked a question before regarding enforcement, and the police commissioner would like to speak to that.
Aaron, you made comment to Sunday's incident. There's a couple of points I just want to raise. Firstly, the BPS for 18 months now have worked in support of the government's position to protect Bermuda from the coronavirus, and we continue to do so. And also to reiterate the point that the Premier's raised, our biggest risk is the border. Now on Sunday it will concern many that a family arrived in Bermuda and did not comply with the quarantine regulations and were allowed to leave the airport. There was a plan in place jointly between ourselves and Health, but quite clearly the execution of that plan resulted in that family leaving. And as already articulated, there is now a process in regards to their accountability in regards to breaching those regulations. And whilst now's not the time to blame, there is a very intense process to look at the lessons learned and the responsibility certainly of the BPS to ensure that it doesn't take place again. And we are aware of other people quite prominently stating that they also intend to breach the quarantine regulations. Let me be clear that what happened on Sunday will not happen again. The lessons learned have been addressed, and we will ensure that the government's quite clear direction and the regulations in place will be adhered to. And certainly any party who feels that they're going to object or they feel that they can leave the airport, that will not take place.
All right, then I will repeat my question to the Premier. You said 2 weeks ago that the government would scrap the mandatory supervised quarantines if Bermuda reached 70% herd immunity. That does not seem to be a part of the stated government policy. Is it policy? And if it is achieved before September 30th, at 70% immunization rate, will it actually be lifted?
What I can say is that as we continue to look at how we approach the virus and the different formulations and other things, those are matters which will continue to be under discussion. It is our view that as we approach a certain level, there can be changes to the protections which are necessary that we may have. And when there is a decision that is made on that, that decision will be certainly announced. But I can assure you that the government will not be announcing anything until the result of the court case which has been put forward. So there's been a number of things which we would have loved to have done, possibly modified or changed, which have been stopped because of the court case, because we cannot go outside that process. We must respect that process, and we're not going to make a mock of that process. We've engaged in it, and we will wait until the Chief Justice renders his judgment. And at that point in time, we, the government, will then move forward with either changes, adjustments, required change adjustments, which may come out of the ruling. We will see, but it would be improper for us to make any announcements or thoughts or other things prior to the receipt of the judgment.
Right. Thank you very much.
You're welcome.
Premier, we now have TNN.
Thank you. Good evening. Last week, Friday before last, TNN broke a story of an individual that came through the airport, and there was a situation on the airport with a mother, grandmother, and a baby. Premier Burt, you tweeted that was fake news. The minister released a statement, and on Sunday I produced a audio soundbite of the mother. Since then, there's been no apology to the mother, nothing stated about the situation, and no apology to TNN. Why?
I will start, and maybe the minister can follow up. I have not listened to the audio soundbite. I stand by the perspective of which I had stated, that it was, number one, an incorrect story. Number two, your story stated that you had contacted the government prior to its publication. There was no record of that found whatsoever. In that case, this was just keeping inside of Media Council rules. We would have been able to advise the situation, and it is categorically incorrect that we forcibly separated a mother from her child, and we stand by that position.
I have nothing to add. The Premier is exactly right. That is the position.
How many people has government hired to man the hotel facilities, and what is the cost of these salaries? What's the cost of these individuals that are manning these hotel quarantine facilities?
It's interesting. The media is asking all the parliamentary questions that we have on Friday.
Are we not allowed to ask questions, sir?
Again, I'm just saying it's
No.
just rather coincidental that the questions that are coming from the media are the exact same ones that have been submitted by the opposition for answer in Parliament on Friday. Go ahead, Minister.
Yeah, we actually have this as a parliamentary question for Friday that came to the Minister of Health, but they do fall under the Ministry of National Security. At this stage, we have 19 persons that have been hired. I don't have the dollar value off the top of my head at this time.
Well, okay, thank you. Let me just state that I've had this question for a while, as we only get 4 questions. So we have a lot of questions in our arsenal that we never get a chance to answer. So forgive me if you feel that this question is coming from the opposition. It's not. Thank you very
I
much.
was saying it was rather coincidental, but that's okay. You can go ahead.
Anyway, Premier Burt, there were many people that were allowed to flow through the process that were sent through. They went right through the. They weren't allowed. Matter of fact, there was a situation at the airport where individuals were supposed to go to the quarantine location, but they flowed through. And after that, I guess authorities went to track down these individuals from their residence. There's been nothing stated about the outcome of that situation. There's been a lot of energy that's been demonstrated on the Cananera-Watson situation. Why not the same energy for the 2 different circumstances?
I'm not sure what the first circumstance that you're referring to.
There were people that came through the airport that should have been quarantined. And it was stated, and authorities were supposed to go and get these individuals and take them to the quarantine locations. There's been nothing, no update on that matter.
You're referring to the episode on Sunday.
Was this? No. A few weeks ago.
Oh, I'm sorry. Okay, I'm sorry, Trevor. Can you repeat that? I'm sorry. I didn't understand what you were saying.
Oh, God.
I'm
There
so
were-
sorry.
there-
I
there were-
misunderstood. I didn't understand you.
There were many people that came through the airport that should have been quarantined.
Yes.
What is the update on what's the outcome of those individuals?
those
Were
in-
they apprehended and taken to the quarantine facility? And what I'm trying to say, there's been a lot of energy into the Cananera-Watson situation, but not the same energy for this issue that's
Well, I
arose.
think the distinction there is twofold. One is that they weren't apprehended. They were called and contacted and indicated that you should be in quarantine at a facility as opposed to the home. So those individuals that did not have transportation was arranged to escort them to the facility, but they were not apprehended. And 2, I don't remember the numbers right now, but there were maybe a couple that were actually about to be, their quarantine was going to end that day. We have rectified that situation. The bulk of those individuals, as I recall, did go to whichever quarantine facility took them. I don't know which one, so I can't speak to where they went, but they did. However, again, the word apprehend is certainly not an accurate reflection of what actually happened, because they
or sorted
were
things.
called.
Let's use the word sorted. Were they sorted? And
They were sorted.
yeah. Okay. My last question, Premier Burt. Bermuda is in the greatest state of division that we've ever seen for a while. The economy, social, and economic suffering is beyond anything we can imagine. Knowing all of this, you choose to spend last weekend, and there are many videos and pictures circulating on social media that you were out in the public at different functions, different parties, having a great time. Is it your position that partying all weekend during this time of social crisis is the best demonstration of leadership skill? Is this what you believe the country needs at this time?
Well, thank you very much, Trevor, for your question. I'll start with the first part of it, where you said that you feel that we are in the greatest state of division, and I do not agree that we are in the greatest state of division for a long time. What I know is that there are persons who are deliberately doing things for political aims and objectives, and that is their ability in a free and democratic society. But I will certainly disagree that we are in the greatest state of division that we've been in for a while. You then went on to state that I was partying all weekend, and I can promise and assure you that on Friday I was working until very late, and on Saturday, just like every day, I worked, and on Sunday, just like every day, I worked. That is just the nature of this job. We work every day. My wife and I were invited to two events of where it were 90 persons who came to this country to celebrate someone's birthday, including the president of the NAACP, the immediate past chair of the NAACP, the vice chair of the NAACP, persons that are involved in the U.S. civil rights movements and others. We were invited to two events. We attended. Those events not only were hosted, they used, and I was very proud to say, because of the people who were coming, they used all black small businesses. They made sure that they hired local persons, and it was great for the economy. And so I'm not going to apologize for my wife and myself attending those events, because you know who else is not sorry for those events?
Were you not at a beach party at Saturday night
the people who
at
worked.
John Smith Bay?
Oh, absolutely I was. Hold on one second.
Okay.
Oh, so here's the thing, Trevor. So let's so we can be
I'm,
clear
I'm
on
just
this.
saying, and
No.
many questions were, and many pictures were going around on social media. And let me just clarify, when I mean the divisions, is the vaccinations against the unvax.
That's perfectly fine, Trevor.
That's
Are you going to let me answer the question?
yes, sir. Go for it.
I am the minister who is responsible for tourism. I have no greater joy than showing people my country. No greater joy. We went to the Unfinished Church for a wonderful event on Friday. The event ended at 10. People said, is there something else? I asked a DJ who happened to be a constituent of mine, is there anything else going on? And they said there's something at John Smith Bay. And the minibus stopped at John Smith Bay. And so the fact is, this is what we do in Bermuda. But here's the reason why we can do it. We can have outdoor events that are unmasked, where people are enjoying themselves because of the steps of which we've taken at the border and the strong work of which we've done. So we can't have our cake and eat it too. It's either we want to support the economy, we want tourists here, we want to show them a good time, just like we have a good time ourselves, or the other way around. And so from the perspective of this, absolutely. Hold on a second. This isn't a debate. You asked a question. I'm giving an answer. Then we're going to move on to Ms. Palacio. You've asked a question. I'm giving an answer. So on all of those things, I work hard every day, and I will continue to work hard every day. And I will make absolutely no apologies for taking an evening off with my wife.
Premier, we now have Media Maya.
Good evening, everyone. Maya Palacio for Media Maya. My first question is to the Commissioner. Stephen Corbish, please. Commissioner?
Yes.
Good evening. You responded to a question in the Gazette today, well tonight, and said that there was lessons learned within the breach of the airport and the persons going home. My question to you is, what now will be taking place? What will be the process of an individual who objects to going to the quarantines? What will the police be doing?
Okay, well, I mean, the regulations are quite clear in support of the Quarantine Act and the procedures that we've got in place around the border security. The issue around the lessons is about the responsibilities of the BPS working with health, and quite clearly, as I've explained, there was a plan on Sunday and that plan did not work, and that allowed a family to leave the airport. Subsequently recovered, and we're in process to address that, but quite clearly there was an issue that took place that we needed to rectify, which we have. So going forward from now, that we have reviewed the processes, how we work with health, the role of the BPS, and if somebody does not agree or fails to comply with the quarantine process, then there is quite clear regulation which results in detainment, arrest and prosecution. And we have put additional resources in to make sure that takes place from the BPS perspective, and we've been in dialogue with the Ministry of Health and key members throughout the day, which will continue, and we've got another meeting tomorrow, taking account that we have information which is widespread in the community that others intend to come to Bermuda and disobey what is essentially the law around quarantine. So whilst I regret Sunday, I'm satisfied that we are back in place to address this issue going forward.
Thank you very much. My next question is for the CMO. Good evening. So tonight you explained fully the differences between the natural immunity and the vaccine immunity. Now, you said that if someone who is naturally immunized and they had a severe infection, that means they have higher antibodies, but if they have a low infection, they have lower antibodies. And that the natural immunity only lasts between 3 to 8 months. I'm wondering, is there a way for Bermuda to, for those persons who ask about it, allow for those who can prove that they have a higher antibody because they had a severe infection and can prove that they still have higher, antibodies within those 3 to 8 months?
Okay, so I'll answer that question in ways. There's nothing unnatural about vaccination. What vaccination is doing is giving you a part of the virus and your body responds naturally to it. What you probably mean to say is infection from a virus, and that is you are exposing yourself to the virus with all the risks that comes with it. Mm-hmm. So there's no natural immunity. Both of them are natural. Both of them depend on the body's reaction to either the whole virus or parts of the virus. So that's the first point I want to make. The second point you said is about people being able to prove that they've been in hospital for so long and therefore they will have developed immunity and therefore they should not need to get vaccinations. First of all, it is very, very difficult to measure, and that's what I mentioned in my presentation. It's extremely difficult to measure. When you measure it, the interpretation is actually quite complex because you're only looking at a small part of a very big phenomenon, and that fluctuates with time. So it's a very, very complex thing to measure. The simpler way of doing this and the number of is to get vaccinated, and there's a lot of evidence that people, even those who've had the infection, will still benefit from having the vaccination because it gives a consistent protection that you can actually rely on. When you have an infection, you don't know what parts of the virus your body is developing immunity to, and that varies quite widely. So it's important that's why we're using something that is consistent, measurable, and protects everybody, frankly.
Thank you very much for explaining.
Okay.
My next question, I suppose, can go to you, Mr. Premier. What department in the government is in control of the CCTV cameras and the contracts?
You're right here. The Minister of National Security and or the police.
Okay. Is there any updates on the cameras that the police had mentioned a few weeks ago that were not in operation on the island and they weren't working?
Thank you. Good evening, Maya. We continue to have challenges with our CCTV system. Part of the reason is because I believe the system is either 10 or 11 years old. And earlier this year, we did a major revamping of the network cabling. And part of that was so that we can ensure that more cameras are working and are operational. So that continues to happen, and what we were finding is that we're spending more time with a camera going down and then trying to make sure that the cameras are coming back up. So what we're doing right now is we continue to do the maintenance on the system, but we are also using this period to do some research on what a new potentially CCTV system will look like.
Thank you very much.
Okay.
And my final question. Yes, I actually witnessed myself somebody inside a store who spoke to another and told them you need to be putting on a mask, and they explained that they have an exemption. They put up something on the neck saying that they do not have to wear a mask inside. Is that even real?
I don't want to speak to the generality of that particular question, but it is required to be wearing mask inside.
So if somebody goes on saying that, oh, I'm exempt, I don't need to wear a mask, that's the lying, basically?
I don't want to say they're lying. I'm just saying that the requirements and the guidance say that you should wear a mask indoors. I can say that there are certain circumstances where a person may have a particular medical condition that may prevent them from wearing a mask because having something close to their face may create some type of adverse sensation and reaction. But I don't want to speak out of school, but generally speaking, the requirements of public health are whenever you're indoors, you are required to wear a mask.
And just one final follow-up from that. Can you say that the Ministry of Health has not given out any exemptions for persons to do
Not to my knowledge, no. I was thinking of a person that perhaps might be autistic that might have challenges with respect to having a mask, but no, to my knowledge, we've not given out any exemptions.
Oh, thank you very much. Those are my questions.
And thank you, Ms. Foster. I just want to say condolences on your loss, and I think it is amazing for people in this country how open you are with the situation and to help people to learn and to grow from your things. So I just want to say condolences to you.
Premier, Island Stats.
Good evening, Minister of Health. There seems to be some confusion when it comes to the authorization of large sporting events where non-immunized people have to be tested, and we'll find out whether or not they are negative or positive, but the people that are immunized are not, but can go to the event. Can we clear this up a little bit? Because there could be someone immunized carrying the virus and can potentially pass it on, but they don't know because they're not being tested going to the event, just like someone who is unimmunized, but they get to find out before they get to the event.
Are you referring, Mr. Basin, to the use of the safe key?
Yes.
Yes, well, the use of the safe key, when that is required, the person can enter the event and obtain a safe key in one of two ways. One is if they are immunized. Two is if they've had a test that's negative for COVID within the last 72 hours prior to the event. So a safe key is administered and issued on those two circumstances.
Okay. But a person that is immunized, can they still carry the coronavirus and pass it on?
Yeah, we've talked about that here too. I have the CMO, but we have spoken about that. But the risk is very, very minuscule insofar as a person that has been immunized and then contracting the virus and then being able to transmit it.
But then the person that's unimmunized that contracts it from someone who's immunized, do they become the risk? Not the person that's immunized, it's the person that's not immunized.
Well,
Can they contract it from the person that's been...
The risk exists, but the risk is far more weighty and heavy for a person that's unimmunized, because you've heard us speak about the fact that a person that is immunized has a lower, let's say Pfizer, for example, the efficacy is 85%. So there is a less likelihood that they will get very, very ill from COVID, be hospitalized, or die. That's the whole point of immunization. However, a person that's not immunized and contracts the disease does not have that same level of protection that we've spoken about previously as somebody that's immunized.
But the general consensus is that if I'm immunized and I go to an event, but I'm carrying the COVID-19 virus, and you go to the event and you're not immunized, I can pass it on to you because I haven't been tested to go to the event.
But what we said, Mr. Basin, is that the ability to transmit the virus for a person that's immunized is minuscule. A person that's not immunized and they catch the virus will have a more likelihood of having, they don't have the same level of protection as a person that's immunized. So therefore, they could get very ill, they could get hospitalized, and they could die.
That is understood. But I'll answer one more way. Maybe the CMO can answer this.
If he knew what the question was.
Earl, I think we all understand your question, but I think what the government has laid out is the position of where we are with the comfortable of where we are insofar as risk management at large events using SafeKey. So, I mean, you're not going to necessarily get a different answer. If the circumstances of the ground change and we feel that we need to have a different approach, then we'll have a different approach.
Okay, no, that's it. Yeah.
And Premier, we'll hear now from Bermuda Real.
Yes, good evening, panel. Ciola Wilson, Bermuda Real. With respect to protocol, I would start with you, Premier Burt. With regards to you reiterating in recent weeks that you will not lift this mandatory quarantine for non-vaccinated passengers until such time as we reach 70% herd immunity. I believe the figure cited tonight was 65%. Since then, we've been hearing about additional booster shots required for these new variants, which gives rise to COVID 21, 23, and 19. For the record, can you set me straight? As it stands now, with the exception of a Supreme Court ruling that may throw out this position on the part of your cabinet, based on constitutional or whatever, should that not happen? And let me say this is my supplementary first question. Am I clear that depending on COVID figures, this whole mandatory thing will finish at September 30th based on figures still going down? Yes or no?
The law as currently written has mandatory supervised quarantine extending until ending on September 30th.
So if figures continue to go down, it will follow logically that it could be over by then with or without a Supreme Court ruling.
It expires currently, set to expire on September 30th.
So my 1A question would be, based on this ruling, whether it comes or not, and it may be directed to the commissioner, but let me start with you. If in fact it's mandatory and I arrive with or without my family unvaccinated, the police have stated with all this jumbo outside of Ms. Cannonier's home that they have discretion, the minister has discretion. Ultimately, the health people back down. Today we're hearing she's going to face charges in court. Without hearing the charges, what's the position? Because Bermuda Real's initial report is that we have reports of several Bermudians unvaccinated. One who is highly, and the commissioner said tonight, who have stated, we're coming back. Do the police have the power to arrest people at the airport? If we have mandatory laws, is it mandatory or not? Because this family left. And what's stopping me or any other Bermudian coming in who say, I'm not paying this money, semi-COVID, or Westgate? I also heard the Minister of National Security say, out of the X number of people in mandatory, government is paying anyway. Can you clarify for those who are asking me, please?
Do you want to answer the second question?
Good evening,
I think
Mr.
the
Corbishley.
majority of your questions already been answered. Okay, we've already touched on Sunday how a plan should have been executed, but it wasn't.
But it wasn't.
It wasn't.
And you said tonight that come tomorrow, anybody else, and high-profile people have said they're coming, take me jail. Do you have the power to arrest me at the airport or not?
There are powers of arrest.
But you
within
didn't
the
use them.
Quarantine Act.
So is it mandatory or not?
Let me be clear in going forward.
Please.
If somebody comes into Bermuda and either states or fails to observe the legal requirements of the Quarantine Act, then they will be subject of detainment. Because, and again reiterating what the Premier said at the beginning of this conference, the single biggest risk to Bermuda is at our borders, and we are still dealing with the risks of coronavirus. So the statement and position of the BPS is as I've described. if somebody does breach at the airport, which is a high-risk situation, re-entering the country, they will be subject of
I get
detainment
that.
and
And
arrest.
with all due respect, that's not what your police spokesman or former broadcaster said. He issued a vague statement at 2:18 saying, yeah.
Okay.
So
well,
what are you saying when Antonio Belvedere returns tomorrow and other people come the next day and say, take me jail or take me home? What are you saying? It's going to go different from the Cannoneer case? Yes or no?
I'm not going to talk about particular people, but we're aware of
understand
this.
that too. But you said tonight, come tomorrow, it's going to be a different scene. Is it mandatory? Is it law? And if so, why is it not being enforced? And if it's not,
Okay,
we'll
Ciola,
see.
let me answer the question, okay, and it will be the final answer. I'm quite clear that if somebody comes into Bermuda and chooses to not comply with the Quarantine Act, they will be detained at the airport in the interest of security, health security to Bermuda. And that will take place. And there are lessons learnt from Sunday where that did not happen. Whilst the situation's recovered, we've got to take that on board and make sure that from this point on, as I've described, that is what will happen.
Well, I just finished that in a lead up to that should have happened in the first place. But Premier Burt, with all the respect to you, my last question would be this, because we haven't seen a popularity poll. I'm not really sure if you or your administration even care, right? But the sentiment in the community is this division created by your administration regarding vax or non-vax. And we woke up on Monday morning to reports like Bermuda's on fire with regards to all this madness, while you, the premier of this country, appears to party. This is 2 or 3 weeks after a shag or a raft up that you said you had no knowledge of. You're the Minister of Tourism. Let me finish with this last question. How is it tonight you can announce that Southampton Princess, which has been closed all this time, has no staff, is open at the lowest rate for this mandatory hoax, right? Who's doing the housekeeping when they're closed? How did that happen? And is it true that Princess is now looking to reopen without the massive development? Because contrary to popular opinion, no matter what, you're the Minister of Tourism, and we still don't have heads and beds.
I'll try to answer the questions. And
Please.
the way that I'll answer it is this. My approach to this job and my family and my colleagues and everyone know that I work extremely hard, and most nights I go to bed at 2 or 3 a.m. after working. All of my cabinet colleagues have received those messages. The CMO, others get the emails from me at 2 and 3 a.m. And so persons may wish to question my work ethic if they want, but I think that it will be very difficult in which to do so. So let me just leave and park that there. On the issue of, you've asked a question, and I'm answering the question. On the issue of heads in beds, I know that you arrived late, but I did speak about
I heard
tourism
you.
inside of
Outside
my
of this
remarks.
room, I heard you.
Thank you. I spoke about tourism in my remarks, and I have said that some hotels are seeing hotel occupancy at levels equaling 2019. So we are without question making progress in that regard. And we're making progress on that regard because people recognize, know, and understand that Bermuda is a safe place to visit and a safe place to travel, and people want to vacation in a place where they know that they can feel safe and enjoy. And so that is the record that this government has, and
My
I'm
question
proud
was,
that has
how
happened.
could Southampton Princess be open when they're formally closed? Who's doing the housekeeping? How did that happen? I'm done. That's my specific question.
Premier, there are no further questions from the media.
Okay, thank you. In saying that, I want to say thank you to the Fairmont Southampton for assisting the government of Bermuda in making additional quarantine facilities available so that that can happen in that case and instance. And what we're looking for the Fairmont Southampton to do is to redevelop, and we're continuing to work with that, as has been stated numerous times at press conferences by the government. In closing, I would like to say I want to thank all members of the media for their questions. I want to thank everyone for the work and support, and I want to speak to the vast majority of the population that are following the rules, that are doing what is necessary, and that are working and cooperating with their friends and neighbors to ensure that we move beyond the pandemic. The example of which Bermuda has set to the world is one where you can follow science, where you can have strict border protections, and that your citizens and tourists can enjoy the country that they live in or the one in which they visit. So with that, I wish to thank everyone, and I look forward for those persons who are attending the county game this weekend, get your safe key, be safe and enjoy. And for those persons who are not, enjoy your weekend nonetheless. We'll be back here with you in 2 weeks' time to give a further update on the coronavirus. So with that, thank you, Bermuda, and good